Thank you so much. It's a great honor for me to be invited to join this webinar meeting, and I'm very glad to share a very interesting study which was conducted in our single center. We compared the effect and safety of microwave ablation versus radiofrequency ablation for benign non-functional solid nodules. Today, I'm going to introduce my topic in 5 parts. Firstly, let's go through the background, and I think everybody some ablation now is first line treatment for benign thyroid nodules, which is not a very good candidate for surgery. And the microwave ablation is mainly used in mainland China. However, there's little study to a few studies to compare the efficacy between microwave ablation and radiofrequency ablation in the treatment of benign thyroid nodules. While radiofrequency ablation is mainly used in Korea, and then it was introduced to the European, American, and now there's a lot of evidence to show that radiofrequency ablation has a favorable efficacy in the treatment of benign thyroid nodules. Therefore, in the last year, European Thyroid Association and recommend that the laser ablation and radiofrequency ablation as the first line when the patient choose some ablation treatment for their benign thyroid nodules. However, let's go through the principles of radiofrequency ablation and thumb ablation. And there's some technical differences between radiofrequency ablation and thumb ablation. And briefly, that microwave ablation has the potential to produce faster and larger ablation volumes with less susceptibility to the heat sink effect. So there are some studies to compare the radiofrequency ablation and laser ablation because of the technical advantages, just like moving shooting, and the radiofrequency ablation may achieve a larger volume reduction rate when it is compared to laser ablation. And there's some meta-analysis and some randomized control studies have proved that the effect of radiofrequency ablation is better than laser ablation in the volume reduction rate. What about radiofrequency ablation and microwave ablation? There are 2 studies from China has tried to elucidate the effect differences between radiofrequency ablation and microwave ablation. This study from China was conducted in many centers. This is a prospective multiple center study, and finally a total number of 1,252 patients was treated with radiofrequency ablation, I mean microwave ablation. And when the efficacy and the safety was compared, the radiofrequency has a slightly better effect in the volume reduction rate when it compared to microwave ablation. And no significant differences between the microwave ablation and radiofrequency ablation when this is from another study, and this is a total of 943 patients received microwave ablation or radiofrequency ablation, and after 1-to-1 propensity score matching, 289 pairs of patients was matched. And this study didn't show any differences between the microwave ablation and radiofrequency ablation. Therefore, we conducted a randomized control study to compare the efficacy and the safety of radiofrequency ablation and microwave ablation for the treatment of benign non-functional thyroid nodules. Therefore, I'm going to share some details of our studies. First, let's go through the materials and the methods. This is the inclusion criteria. Briefly, the nodule should be confirmed by fine needle aspiration or corneal biopsy to be benign. And the patient should have some complaints of compression or some cosmetic problem. This is exclusion criteria. And we collect the basic information from the patient, and we also perform ultrasound imaging studies regularly, and we calculate the volume and the volume reduction rate, and also we record the complications technical and effective rate to calculate the true effect of two methods. Here is the results. This is a flow chart of patient enrollment procedure. Finally, 36 patients was enrolled, and 18 patients was allocated to microwave ablation, and another 18 patients was allocated to radiofrequency ablation, and we followed 6 months after the treatment. And this is the baseline characteristics, and you can see there's no differences among differences between these two groups when they was enrolled in the study. And this is the volume change in radiofrequency ablation group may have a smaller thyroid volume after ablation. And this is the volume reduction rate. From here, you may find at the 3rd month follow-up, the radiofrequency ablation has a higher volume reduction rate. However, when the patient was followed at the 6 months, there's no difference was found. What about the effective rate? From statistically, there's no differences between these two groups in the effective rate. However, you may find the radiofrequency ablation group have a higher effective rate. Difference. This is the typical. There are some pictures from 2 patients, and these typical images show a significant volume reduction during the follow-up. What about some secondary outcomes of 2 groups, just like cosmetic scores or complications? There are no differences between the complications. However, the radiofrequency ablation has a lower cosmetic scores. It may indicate radiofrequency ablation has a higher efficacy in the treatment or to solve the cosmetic problem. What about the thyroid function? As we know, these 2 effects doesn't change thyroid function after ablation, and this is also proved by our study. Most effective and safe methods in the treating benign thyroid nodules. Larger volume reduction rate can be achieved in the radiofrequency ablation group than that in the microwave ablation group at the 3 months. Radiofrequency ablation group had a lower cosmetic score than that in the microwave ablation group. So let's discuss why there are some slightly differences among these 2 groups. It may be because of the technical differences. In the microwave ablation, the higher central temperature in tissue, usually more than 150 degrees, which was commonly produced by microwave ablation. Therefore, the carbonization may occur easily, even at a relatively low power output. Therefore, this may cause some differences in these 2 treatments. lower microevaporative power output of 20 to 35 might contribute to minimize the carbonation in the ablated nodules and increase the volume reduction rate of microevaporation group at follow-up. Thank you so much.